Hi, welcome to week 7, the integumentary system. I'd like to provide you some very current guidelines for the management of pressure ulcers. We know that pressure ulcers is a hot button for hospitals, other healthcare facilities, Joint Commission, other accrediting bodies, insurance companies, and of course for patients and their families. We do things for patients to identify those who are at risk for pressure ulcers, as well as treating those that already have pressure ulcers. And there is a myriad of information and guidelines and recommendations for the treatment of pressure ulcers. However, long gone are the days when we can just say, oh, we do this because we've always done it that way. That never is a positive statement. We want to provide evidence-based care that has been shown to make a difference. So I found this information, and I think you will be interested in this as well, because it speaks to information that we always have assumed is evidence-based, and come to find out not so much. Recently, the American College of Physicians reviewed the literature to determine if the current recommendations for the prevention and treatment or caring for pressure ulcers was backed by evidence of efficacy. In other words, is what we're doing really working? And they wanted to see what studies had been done to show that it is. The most recent guidelines and recommendations were published in March of this year, of 2015. What I find very interesting is that the evidence only supports 3 recommendations. The evidence for these 3 recommendations was at best weak and based on small numbers of subjects. The researchers asked 2 questions that they were looking for answers in the available literature. The first question was, when comparing treatment strategies, what is the effectiveness of these treatment strategies to promote improved outcomes in adults with existing pressure ulcers? The second question they sought to answer is, what are the harms of the treatments used for existing pressure ulcers? The article that I reference here provides easily readable tables of all the comparisons of all the methods, the level of evidence, and the quality of that evidence. I will provide a summary here of that information, but it really is a good use of your time to review this article and these tables. I think you'll be quite surprised at what you see. But in summary, complete healing was reported infrequently in these studies, regardless of what method they used to treat the wound. Another finding was improvement in the size of the wounds was generally reported only for larger wounds. Third, there was moderate quality evidence of healing for the following: protein-containing supplements, air fluidized beds, and electrical stimulation. And there was low quality evidence for the use of hydrocolloid dressings being better than gauze dressings, and they found no difference using electromagnetic therapy, therapeutic ultrasound, negative pressure therapy, light or laser therapies. Those of you who work with patients with pressure ulcers on a regular basis may be aware of all of these methods that are listed here. And you use them because there is evidence that they work. There was also low-quality evidence to support differences in risk of developing pressure ulcers after certain surgeries. Similar results with electrical stimulation was found in a hospital setting as well as a rehab hospital setting, and they are comparable. The researchers also reported quality of evidence findings for harms caused by the various methods used. So the American College of Physicians formed a panel to wade through all of this information and come up with recommendations. And as noted earlier, they came up with 3. The first recommendation is the use of protein or amino acid supplementation in patients with pressure ulcers to reduce wound size. The level of evidence, however, is weak and it's low quality. In other words, there's not a lot of subjects that were studied. Some of the studies only reported one outcome, and so there isn't a lot of high quality information to be had. The second recommendation is the use of hydrocolloid or foam dressings in patients with pressure ulcers to reduce wound size. Again, level of evidence is weak and it's low quality, but there at least is some evidence that these dressings do help to reduce wound size. And the last recommendation is the use of electrical stimulation as adjunctive therapy in patients with pressure ulcers to accelerate wound healing. Again, same level and grade of evidence, although this is moderate quality evidence. Looking at pressure ulcer assessment and treatment, the article that I included here with the 3 recommendations from the American College of Physicians was presented in the Annals of Internal Medicine, and then there was an editorial that was written by a PhD prepared RN, and she really looked at all of the information that was presented by the American College of Physicians and critiqued it, and she did a really fabulous job. What she concluded is that the current risk assessment tools are imperfect at best at predicting risk for pressure ulcer formation. There is very little information and evidence that tools such as the Braden scale really are accurate risk predictors. And we use the Braden scale as almost the Bible of risk assessment. She noted that there were about 77 current guideline recommendations that have any support at all. But there are 498 recommendations that are out there and based on expert opinion, but they lack significant evidence. And only 3 are evidence-based, and they're not very strongly backed. And these are the ones that were put forth by the American College of Physicians. When you think about the implications for your practice, it can boggle your mind. I believe this is an area where advanced practice nurses can really make a difference. We look at the evidence, we look at what the research shows. We can be patient advocates for using the methods that have at least moderate and low quality evidence, as opposed to using something that an expert says works. We can help our patients. We can use these therapies. We can monitor the results, and best of all, we can then report them in the literature. Small-scale studies can be undertaken and reported. Even reporting evidence that doesn't show any benefit can be helpful. Finally, the article that is included is really a good example of how to write a review of literature, especially at the beginning, which explains how and where they looked for sources and the overall findings of specific groupings of sources rather than individual articles. These are the references for your perusal. If you have any questions, please don't hesitate to contact me. Thanks again for your time.